goal of Saskatchewan's healthcare system is to ensure people have the best possible health and care experience. We are putting patients first by welcoming patients and families to participate in their care and in the design and planning of the care and services we provide. The focus of patient and family-centered care is on creating and nurturing mutually beneficial partnerships among Prairie North's team members and the patients and families we serve. Our commitment to patient and family-centered care means we work collaboratively to provide care that is respectful, compassionate, culturally safe, and competent, while being responsive to a patient's needs, values, cultural backgrounds and beliefs, and preferences. Let's hear from a patient about what patient and family-centered care feels like.
3 o'clock in the morning, I got up, and when I got up, my arm fell and banged against the wall, but I didn't feel my arm. And that is the most bizarre experience that I've ever had. Stranger than that was realizing I'm having a stroke. Going into the emergency room changes everything. I'm scared, obviously. It's as if you have no power, you suddenly become anonymous, and you're looking around at the emergency room thinking, oh my God, this could be it. As the doctor walked by, he got down on one knee and he smiled and put his hand on my knee and said, tell me what's going on. And he did it with a kind of, we've got time for this. He did it with compassion. He did it with a lot of heart. It was like there wasn't anyone else in the room except the two of us. And for that moment, I wasn't afraid. For that moment, I wasn't alone. And in that moment, I felt like there was something good that could come out of this. And I decided that at that point, the hospital was going to be my family, and it was actually a positive experience from that point forward. Patient-family-centered care means let's find out what the patient thinks of this experience every step of the way and how we can intervene in language and in behavior in a way that makes sense. So I joined the Patient Family Advisory Council in order to figure out if there's anything I could do, given my experience with my stroke, that would be helpful. Looking at all the different things that the hospital could do from the patient's point of view. And I noticed things like papers that we had, forms that we had that we gave to patients that read like something that a lawyer might have sent to the AMA. We were thinking together as patients what it's like when you're overwhelmed with whatever's going on with you, trying to make sense of something in medicalese. It needed to be more invitational. So what we did is we looked at all the different things the patients sign and looked at the conversational English and how that could work. So we revised, I think, probably 8 or 9 forms. Doesn't seem like a big deal that all of a sudden we have a whole different way of presenting ourselves to the patients. It's the hospital making a commitment to hear from the people they're serving and have it be as important as the service they provide. That is a huge impact. For a very long time, what patients said was just what patients said. Now what patients say is part of what drives the system. My name is Bob Lucken, and I believe that listening to patients transforms everything in healthcare.
According to the Institute for Patient and Family-Centered Care, there's an increasing body of evidence that the experience of care is important, that it matters how healthcare practitioners communicate with patients and families, and that the active participation of patients and family members in clinical care and in policy and program development will enhance outcomes. Prairie North is working to embed patient and family-centered care in all of the services we provide, from in-hospital care to primary health, from therapies to public health, and everything in between. You, as a Prairie North team member, play an important role in making patient and family-centered care a reality for our patients. But you're not alone. Our entire healthcare system is evolving to support you and your colleagues in always putting the patient first. We have largely moved from system-centered care to patient and family-focused care. Now our efforts are on continuing the transformation to patient and family-centered care. Our goal is for patients and families to feel empowered, welcomed, respected, and supported in every interaction with the healthcare system. We want patients to be offered choices based on the best evidence available so that they can be active partners in their care. Patients and families must always be our organization's central focus. There are 4 principles of patient and family-centered care that guide our work and interactions with patients and family. These principles also help us understand where and how we can improve. As I talk about each, think back to a time when you were a patient or were supporting a family member who was a patient. Did you experience this, or was it lacking? How could your experience as a patient or family member have been improved? The first principle is respect and dignity. Staff, physicians, and volunteers actively listen to patients and families and honor their ideas and choices. Patients and family are recognized as integral members of the care team. Care should be provided in an equitable, culturally appropriate manner. Examples of being treated with respect and dignity could include being treated as an equal and as a whole person, not just as a patient, knowing your care provider's name, or being encouraged to share your opinion and ask questions. The second principle is information sharing. The phrase, "nothing about me without me," means patients have the right to receive timely, unbiased, and accurate information about their care. Patients should be supported to make informed decisions about all aspects of their care. Examples of this principle include having access to your medical chart and other documentation, or being informed of all your treatment options. The third principle is participation. Patients and families are empowered to participate in their care and decision-making at whatever level they choose. Staff, physicians, and volunteers work with patients and families to provide care collaboratively and in the way that best meets the needs and goals of the patient. Participation gives the patient and family the opportunity to take part in their care and decision-making as they are comfortable. Further, patients and families can participate as advisors in the planning, design, and evaluation of healthcare. The fourth principle is collaboration. Patients and families help co-design healthcare. They actively participate in developing, implementing, and evaluating health policies and programs, designing healthcare facilities, professional education, and in the delivery of care. Collaboration builds on participation. We seek to ensure that patients and families are equal partners in their care, and that all healthcare providers work collectively and share information freely with each other. So as you do your work with Prairie North, think about how patient and family-centered care helps us in our mission of working with individuals and communities to achieve the safest and best possible care, experience, and health for all. How are our organizational values of quality, compassion, excellence, accountability, and respect reflected in the ideas behind patient and family-centered care? How will you help transform Prairie North into a truly patient and family-centered organization? The work we do and how we do our work matters. We are all the patient experience.